that. And I also want to talk about this today. And this is a crucial conversation that we have had before and we'll have again, but you can never have it drummed into you enough about checking your body and knowing your body and discovering if something's not quite right. Because on a serious note, it can be a matter of life and death. It's been a very hot week here in Essex. Temperatures have probably reached about 30 as well, and the late 20s for sure. But how prepared are you to go out in the sun? This next story comes from Natasha Gowan from Leigh-on-Sea. She's being treated for skin cancer, but it was her 11-year-old daughter who spotted a mole on her back as she stepped out of the shower. And Natasha then rang her GP and was diagnosed with an aggressive melanoma 2 weeks later. Your stories, please, of cancer diagnosis, because it could be crucial. You know, one person could be listening today, decide to check themselves as a result of this conversation, and it would have all been worthwhile. Let's speak to Natasha and her daughter Maisie. Hi to both of you.
Hello.
Hi. So Natasha, you've got a lot to thank Maisie for by the sounds of it.
Yeah, I definitely have, yes.
Tell us the story.
Yeah, so it was just a Saturday morning. I've noticed this mole on my back. I'd had it there for ages and noticed it'd been changing a little bit, but didn't really take that much notice of it. And then, yeah, one morning I got out the shower. I was getting ready for Maisie's football, and she was like, "Well, Mum, you know, that mole's really got big, you know, maybe you should go and get that checked." And that was like Saturday morning. So Monday morning, luckily got an appointment straight away and went straight to the doctors. And yeah, they referred me straight away. And within 2 weeks, I was having scans, photos, and yeah, seeing a dermatologist, and yeah, they diagnosed me with melanoma.
And Maisie, what when your mum got out of the shower, what you spotted the mole was a lot bigger, had you?
Yeah, I did, and I thought it looked a bit strange, and it was like purpley and like much bigger than I think it should be.
Yeah, and why did you decide to point that out to Mummy? What had you learned about it that it could be something she needs to get checked out? Why did you do that?
Well, I wasn't really sure what it was, but I thought it just looked a bit weird.
Okay, so you just point out, and then Natasha, well, it's good that she pointed out, isn't it? Because obviously you've then gone through the shock of the diagnosis.
Yeah. Yeah, I mean, it's in a spot that I can't really see very well, so it wasn't an area that I was, you know, looking at every day.
And what was it like getting the diagnosis, Natasha?
Scary, very scary, you know. You hear the word cancer and you think the worst. And then melanoma, which isn't just, you know, melanoma can spread internally, you know, to any part of your body and turn into any type of cancer. So, yeah, it's really quite scary.
What's the prognosis and treatment plan, Natasha?
Well, I'm going to have probably immunotherapy. I had an appointment yesterday with oncology to look at my different treatment options, and I think I'm going to choose immunotherapy. And that'll be for at least a year, maybe a lot longer. I've got another lump up here on my back, so that's another. I'm going into another scan next week to get that one checked. Definitely immunotherapy for a year, and then I have checks every 3 months, I think, like full body checks with a dermatologist. Just to make sure nothing's changing anywhere, anything that I've missed, and yeah, my lymph nodes checked as well, because it was positive in my lymph nodes as well.
And then obviously you've got to share that news with Maisie. I mean, Maisie, what did you think when Mummy told you, you know, what the mole actually was?
I was really sad because I know that cancer's bad, and I thought it's really bad because it spreads easily.
What do you think of Mummy and what she's the fact she's talking about it and telling us about it and getting people to get checked out as well, Maisie? What do you think of your mum?
She's really brave.
Yeah, absolutely. Natasha, obviously you had to share that with Maisie as well, so you wanted her to know and explain it to her. That must have been tricky for you.
Yeah, it was tricky, and the gene that I've got is genetic as well, so yeah, she's going to have to be careful, especially now, in the future. You know, sunburn, even at her age now, can increase that risk of melanoma. So, yeah, we've just got to be careful.
What message do you want to put out, Natasha? Thank you for coming on air to share your story. What message do you want to put out there whilst you're here?
Just be careful. Enjoy the sun. Don't be scared of it. But, you know, go out there, enjoy it. Use sun cream. Cover up if you get, you know, if you feeling like you're getting burnt. Definitely wear sunglasses, maybe even a hat if you can. You know, just please be careful, because you do not want to be in my position.
Do you think it is down to too much exposure, Natasha, in your younger years?
I think possibly, yeah. I have always liked the sun. I mean, most of the time I've worn sun cream, but yeah, I've probably bathed too much, to be completely honest. So yeah.
And it is so easy, Natasha, we'll get Maisie's thoughts on it as well, but it's so easy to, you know, to apply sun cream at the start of the day.
Exactly, that's what I do. Yeah.
And Maisie, what about you? Do you make sure if you're going out in the school holidays, you're wearing sun cream all the time?
Yeah, I always put it on before I go out now, definitely.
Well, good for you. Natasha, I wish you all the best of health and your ongoing treatment. All of us here at BBC Essex, and I'm sure Maisie's rooting for you as well. She's not wrong. You're very brave, and I wish you all the best. All right.
Thank you very much. Thank you.
Maisie, you take care as well, won't you? Thank you, Maisie, and well spotted. Beth Vincent is the Health Information Manager at Cancer Research UK. Hi, Beth.
Hi, Ben.
Hi. No worries. I mean, thoughts on Maisie first for pointing it out.
Well done, Maisie, is all I can really say. And also just thank you, both of you, so much, from myself and from everybody at Cancer Research UK. Hearing stories like yours are so impactful, because we go out here and we talk about the stats and the numbers, but behind every single number, there is a person like you, Natasha, who is going through this journey, and everybody around them is also affected. And just hearing these stories, it's just really impactful and really meaningful. So I'm so grateful to both of you. Thank you.
Yeah, and Maisie obviously spotted Natasha's mole looking a bit different. I mean, how often should we all check our bodies, would you say, Beth, for this kind of thing?
So there's no sort of specific time frame or that you need to check your body. There's no evidence that doing it at a particular frequency or in a particular way works better than anything else. But actually what Maisie said was bang on the money. When Maisie said it just looked a bit weird, that is actually pretty much my message. You know your body and your family members and those who you live with and those who are close to you, they're pretty familiar with what your skin looks like as well. And you know if there's an unusual change. So anything that's unusual for you, anything that looks a bit different, that won't go away, that is when you need to talk to a doctor. And if you'd like, I can talk more specifically about things that can be signs and symptoms of skin cancer. But fundamentally, if you spot something unusual for you, I'd encourage you to talk to your doctor.
And Natasha told us there about the treatment. You know, it used to be, chemotherapy. There are so many, well, not so many, but there are other options now, aren't there? Do you just want to explain a bit about that?
So there are a few different treatment options, and this will vary very much depending on your specific diagnosis, and your doctors will obviously advise. With melanoma, often surgery is the first thing that happens, which is what obviously happened with Natasha. They'll cut out the area and also possibly take biopsies of other places as well to see if it's spread or not. In a lot of cases, and we often hope that might be enough surgery. Unfortunately, that's not always the case. And then some people might have chemotherapy or radiotherapy or immunotherapy. And thanks to research and all the wonderful generous donations from people across the UK who support Cancer Research UK, those treatment options are improving all the time. And actually, since the 1970s, survival for cancer has doubled, which is amazing news. So now if melanoma is diagnosed at the earliest stage, 9 in 10 people will survive their disease for 10 years or more.
So the conclusion then, Beth, is to, if it's the slightest worry, just get it checked, because the early diagnosis is key, isn't it?
Yeah, early diagnosis really can make all the difference. It's with skin cancer specifically, I would encourage you kind of any change to a patch of skin that's not quite right, go and get that checked out. It might be a change in color, it might be a lump or a mark or a freckle, a sore that won't heal or is crusting over, it's scabbing, it's bleeding for a long time. A lot of us know about a new or a changing mole. All of us will have moles. It's very normal to have moles on parts of your body. But something that some people find useful when it comes to moles is what we call A, B, C, D, E checklist. So is it asymmetrical? Does it have an irregular border? Is it changing color? D is for diameter, so is it getting bigger? And the E is for evolving. So is it just changing and doing something a bit strange? Any of those things, please do talk to your doctor.
Beth, thank you for joining us. Beth, the Health Information Manager at Cancer Research UK. If you want to share your stories regarding diagnosis for cancer and then subsequently getting the treatment and beating it, 0800 111 40 41 is the number to call. Very important there. And as actually, and no offence to Beth and Natasha, but it was Maisie who put it succinctly. As ever, you know, just make sure if it is a bit strange, doesn't look normal, to get it checked out. Your thoughts, if you've experienced this, 0800 111 40 41 is the number to call.